So about 2016, there was a lowering of the health advisory for PFOAs and PFOSs. That's when we realized that we had an actual problem here at the plant. And so we quickly jumped on a solution. We went to carbon contactors to lower our numbers for the PFOAs and PFOS. They work extremely well as far as with those two chemicals. We saw some breakthrough with short chains, which is also next on the list. And so we started trying to plan a permanent solution, and that permanent solution for us was a reverse osmosis water treatment plant. So in 2018, we started construction, and we've been up and running now for 3 years. Basically, you can test for 4 parts per trillion on OAs and 2 parts per trillion on OS, and we are non-detect at both of those levels and have been. We actually have been since about the middle of 2016. We had that with the carbon. But like I said, with the breakthrough with the short chains, you had to start saying, okay, are these other chemicals going to be added? And if that's the case, what does the long term look like for this utility? Do we stay where we're at, or do we go ahead and address the problem? So we did a lot of testing, sampling. We tried different things. We tried ion exchange. We tried carbon. We tried RO. Where we saw the best result that got rid of all of the PFAs was with the RO. So we're able to test for 49 compounds right now, and we're non-detect on those 49 compounds. So we're testing at the most they can test for, and we're returning with a non-detect on all of those with the RO.
Walk us through what you had to do to get from where you were to where you are now. A huge expense, obviously.
Yeah. So basically for us, the biggest thing was making sure that we got a lot of samples in. Get a lot of samples, get a lot of understanding what you have going on. For us, what we found was when the river changes. So we have a dam that is upstream from us. So when they go into winter pool, it lowers that water, and so then you've got barges or boats that come through and they churn these chemicals from the bottom. And we were seeing in the wintertime that we were actually bringing in higher numbers. So during the summertime, not near as bad. You had more water, so you didn't have to worry about those numbers as much during the summertime. But that's good for us to learn that knowledge, so we knew what was happening to the river. That's important. The other thing that's important is, you have to go through your test studies to see what works best for your utility. There'll be some utilities that they'll only have the 2 chemicals. There'll be some utilities that'll see, like us, many more than just the 2 chemicals. And so for us, we had to really put a game plan together that was going to put together a sustainable future for the utility. In other words, we didn't ever want to go back to a place where we were in 2016, where we were all running around trying to figure out what we needed to do right then. We needed to figure out what we needed to do for future, for not just my children, but my children's children. So what you're seeing right now is you're seeing different utilities being told, before we were told 70 parts per trillion. Now if you're being told 4 parts per trillion, that's a huge difference. And that means that more utilities have to make decisions, not just some utilities. Back when it was 70 parts per trillion, we were kind of in the lone boat, right? We were trying to figure out, okay, sometimes we see this number get up this high, but it's not there all the time. But there's that case of sometimes it does. So what are we going to do now? And that's what the utility has to do now, is they have to look at this and say, okay, we were good at 70 parts per trillion, and we're good at 10 parts per trillion. But if they make the number 4, we've got to look at a treatment process.
What's your water source?
The Tennessee River.
Yeah. So help us understand how much this project costs. What was the time frame for the construction?
Right.
Developing your plans, construction, getting up and running, and all of that. What did that look like for you?
So it was 2 years, and that's, by the time the engineers had everything drawn out. The total plant cost us $32 million. And we were up and running, like I said, we started in 2018. By 2020, we were up and running. We've been running for 3 years now. And that is, you have to look at, you can't look at what the upfront cost is going to cost you. You've got to actually look at what the next 20 to 50 years of production is going to cost you. So that's what we had to do, is with engineers, we had to sit down and we had to say, okay, is it sustainable to stay on the track we're on, or should we be looking at something that is more sustainable for the future? And that's how we ended up with RO. I think that's what all utilities will have to do, is they'll have to go in and see what's the most sustainable for them.
How did you pay for this project?
So we actually had won a lawsuit, and then we used that money towards building this RO plant.
How much are you spending now each year, now that you have this in place,
Right.
versus what your budget kind of looked like before all this happened?
Right. So obviously something this big, you're going to look at a lot higher electrical costs. I'd say our electrical costs have doubled. There's a lot of, this is high pressurized membranes. You're using, large pumps to push water through, very tight pores to remove these chemicals. So obviously our utility bill has increased. Our chemical cost, I would say they stayed the same, maybe had a slight increase, but the biggest jump was definitely utilities. I think we've increased our budget about $1.5 million over the last 3 years.
How much did the people who live here pay for this?
So the people who lived here did not have to pay for any of the construction. Now, obviously, we operate and maintain. We've been able to really be very cautious with what we do with rates. We're trying everything we can to make sure that the public doesn't have to foot the bill for this. We're trying to be very good stewards with our money in order to run something like this. But at the end of the day, I think we all have to ask ourselves, what's more important? Is it would I be willing to pay for this treatment process in order to know that I'm not ingesting these chemicals? Or, is it better for me to, have a lower water bill? I mean, I want everybody to have, I guess what I'm looking for is a fair price on water, but I also want us all to realize that we're dealing with something here a lot bigger than what we were dealing with 3 to 4 years ago.
How important was it for you to get to this point? For the people who call this area home.
Right. So that was hugely important. I knew that there was a lot of people who were upset with the utility. There was a lot of people upset that felt like we knew something we hadn't shared. And the truth of the matter is, and most people don't realize this, is we are a rural utility. We're a small utility. So, I live on this system. My daughter lives on this system. All these folks in this room live on this system. Their children live on this system. There's no way that knowingly this utility would have done anything to harm our neighbors. But at the same time, we knew that once this became a problem, it was our job and our duty to figure out how we were going to fix this problem. And so, again, you go back to cost and you think, if I'm looking at this from my standpoint, I want to make sure I'm giving my daughter the best opportunity. And future-wise, all of these people in the room, their children, the best opportunity to grow up and live in this community. And so I think that's what we've done with this solution. Most people don't know water treatment. They just turn the faucet on and it's there. We joke all the time, and I say, I don't really ever have anybody call me up and tell me that was the best shower they've ever had in their life. So you don't really hear that. People just expect us to get it right. And so this process that you're going to walk through, you'll see, is us doing everything we can to get it right. We'll bring the water in from the Tennessee River. There's some chemical combinations that happen. There's some settling times that happen. And then it'll move into what we'll show you, which is our membrane filtration. The membrane filtration is actually a pre-treatment to our RO system. And just through membrane filtration, the water is already very, very clean. The RO system is strictly for the chemicals that are in the water. So we could actually put water out through the membranes with no issue. Other than we need to make sure that we get the chemicals out of the water. So that's why we have to move from the pre-treatment, which is the membrane filtration, into the reverse osmosis, which is to remove those chemicals from the water. So to make it easy for you to understand, we use a laser light to look at dirt in water, or to see particles in water. Typically you see about a 10 for us coming in from the river. We bring that all the way down to a 0.012. Regulation says I got to be below a 0.3. Optimized says I got to be below a 0.1, and we're actually at a 0.012. So we're well below. There's literally nothing there. The water is as clean as we can get that possibly. And we feel better about that. I will tell you that I've had a lot of sleepless nights on what we were going to do future-wise to ensure the safety of our water. And I can go to bed at night now understanding that we've put a process in that I can feel comfortable with. When you can pull 49 PFAs and come back non-detect on those, you can feel a little bit better than what was happening to you back in 2016.
Anything else, pertinent to note or you want to share that I haven't asked you already that you think is vital for people to know?
No, I mean, I just think that everybody needs to understand that these chemicals are in a lot of different things and not just water. And then as water managers, obviously we're going to do our portion to remove these chemicals. And each of us are going to have to sit down and make decisions, and these decisions are going to be based on budgetary decisions, but they're also going to be decisions on, health. And so we have to weigh those, and we have to come up with the best possible solutions for our communities. And I think that's, I feel for everyone who has to start making those decisions, because it becomes very stressful trying to make the right decision monetarily as opposed to health related. And I think health is always going to come out on top every time.